Welcome to this explainer. Today, we're diving into the mind-body toolkit. We're going to explore this absolutely fascinating intersection in medicine, specifically how psychological interventions can literally rewire our beliefs, our behaviors, and our moods in a clinical setting. We're going to look at the main types of these interventions and, crucially, check the receipts on how effective they actually are for treating everything from chronic pain to acute stress.
But right off the bat, let me ask you something. Why is human behavior so incredibly hard to change? I mean, we all know we should exercise more, stress less, eat better, right? Yet actually doing those things consistently, it feels like a massive uphill battle. Well, in this explainer, we're going to unpack the exact clinical models that medical professionals use to overcome that stubborn human resistance. So here's our game plan for today. First, the power of psychological interventions. Second, rewiring thoughts and behaviors. Third, the mechanics of change. Fourth, mastering self-management and stress. And finally, the evidence. Does it actually work? All right, let's jump straight into section 1, the power of psychological interventions. Now, take a look at this. You've got the stethoscope right next to the brain, and that's on purpose. It really hits the nail on the head, because psychological interventions, they aren't just talking therapies locked away in mental health clinics. No, they're a fully integrated medical toolkit. We're talking about clinicians using these exact methods to help patients manage severe chronic pain, cope with complex bereavement, lower acute stress, stop risky health behaviors, and even bounce back from severe brain injuries. It's a whole lot more than just having a chat. Moving right along, section 2, rewiring thoughts and behaviors. So this brings us to the cognitive model. This was pioneered back in the 1960s and 70s by researchers like Beck and Ellis. Think of it as this continuous loop. What you think affects how you feel, which affects what you do, which just loops right back around to affect what you think. The core idea here, and this is absolutely crucial, is that the situation itself isn't what causes psychological distress. It's the meaning we attach to the situation. So cognitive interventions step in to identify those unhelpful, irrational thoughts, challenge them head-on, and swap them out for more adaptive coping strategies. Now contrast that with behavioral interventions. These stem from the 1950s work of folks like Skinner and Pavlov, and it is a totally different ballgame. In this model, a maladaptive behavior is seen as just that, a learned response. And hey, if it's learned, it can be unlearned or at least substituted for a better one. The really surprising part, the patient doesn't even need deep psychological insight for this to work. The focus is purely on treating that specific behavior or symptom through direct conditioning and reinforcement. Okay, let's get into section 3, the mechanics of change. Right at the heart of this is something called the CALM-B model. It breaks behavior change down into a beautifully simple truth. For anyone to actually engage in a new behavior, they need exactly 3 things. First up, capability. Do they have the physical and psychological skills to do it? Second, opportunity. Does their environment, both physical and social, actually allow for it? And third, motivation. Do they have the emotional energy and desire to make it happen? To spark real change, an intervention has to modify at least one of these 3 pieces of the puzzle. We can actually see this play out in something called a decisional balance sheet. Think about the struggle to exercise. We've all been there. On one side, you have the immediate costs, the physical effort, paying for a gym, the time it takes away from your family. But you have to weigh those directly against the long-term benefits, like having more energy, sleeping better, and just feeling healthier overall. By mapping this out visually, clinicians help patients confront their own cognitive dissonance. They basically ask, are the costs of changing actually worth the benefits? Now, when a patient gets totally stuck in that ambivalence, clinicians will often bring out motivational interviewing. I really love this definition from Miller and Rolnick. They describe it as a collaborative conversation style for strengthening a person's own motivation and commitment to change. The absolute key word there is collaborative. There's no arguing, there's no persuading, you're not telling the patient what to do. Instead, you're actively encouraging them to explore their own conflicting beliefs. And to untangle that messy, chaotic reality of ambivalence, clinicians use a technique called rolling with resistance. This is so interesting. Instead of fighting a patient's excuses, the clinician uses warmth, empathy, and active listening. They explore the gap between what the patient wants to happen and what they're actually doing. By doing this, they boost the patient's self-efficacy so much that the patient ends up coming up with their own solutions. Pretty clever, right? Moving on to section 4, mastering self-management and stress. Living with a chronic illness, something like diabetes, places an absolutely massive burden on a person. It is so much more than just taking a pill. It's daily medical management, like counting carbs and checking blood glucose. It's role management, where you have to constantly adapt your life around your physical limits. And of course, it's nonstop emotional management. Because of this heavy load, clinicians rely on robust self-management interventions. This means giving patients deep education on their condition, creating specific action plans, and setting up ongoing symptom monitoring so they get regular clinical feedback.
Now, another really fascinating tool in this kit is biofeedback. This is a strictly behavioral intervention. Basically, a patient gets hooked up to a mechanical device that monitors automatic physiological stress responses. The stuff we aren't usually aware of, like heart rate, muscle tension, or even body temperature. Then, as the patient practices relaxation or breathing exercises, they can actually watch the monitor change in real time. It provides immediate visual reinforcement. It literally proves to the patient that they can voluntarily control their body's involuntary panic responses. It is incredibly empowering. Finally, we've arrived at Section 5, the evidence. Does it actually work? All right, this is the crucial part. It's time to look at the clinical data and see the receipts for these interventions. And honestly, it's a bit of a nuanced picture. Self-management shows incredibly strong evidence for improving blood glucose in diabetes and cutting down hospital admissions for asthma. That's huge. Stress management, specifically mindfulness, is highly effective for reducing cortisol and managing grief. But here's an interesting caveat. Motivational interviewing is fantastic for stopping bad habits like smoking or binge drinking, but it actually has mixed, lower quality evidence when it comes to starting positive habits like weight loss. Also, some studies showed that mind-body and traditional talking therapies actually had a non-significant effect on cortisol levels. So the results really depend on the specific tool you're using. Which brings us to our final thought for today. We've seen how cognitive models, behavioral conditioning, and motivational interviewing, they aren't just abstract academic ideas. They are proven, evidence-based tools that manage very real physical conditions like diabetes, asthma, and chronic pain. So, what if the true key to unlocking your physical health isn't just treating the body, but actively rewiring your mind? I want you to consider how your own beliefs and learned behaviors might be shaping your physical reality right now. Thanks so much for joining me for this explainer, and as always, keep learning.